Hi there, happy Monday. I'm a little late today because I got busy with something else. But today I want to talk about medical fear. Uh, and I want to talk about it in light of people's inability, like not lack of desire to take certain tests because they don't want to know the answer, or when they feel like they might have something going on, how much fear it can generate, and how to deal with fear or anticipation when you're worried about the results of testing for something. So, I'm Dr. Shiroko Sokitch, owner of the Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible: 7 Keys to Defy the Odds. And I often see patients with, actually, years ago, had a woman who came in and she was terrified of whether she might have some disease, and her parents had had some bad experiences in hospitals, and she was just terrified of doctors and hospitals, and she couldn't bring herself to get testing done for certain tests that she was worried that might turn out positive. So I worked with her using my post-traumatic stress disorder acupuncture treatments to help her overcome what had happened to her parents. And then she was able to overcome her fears and be able to go and get the tests done that she needed. And then when she turned out to have a diagnosis, she was able to go get the treatment that she needed, and she sailed through it without difficulty because she was able to deal with her fear. So I want to talk about that because a lot of times we feel afraid of things. There's lots of things happening on earth right now anyway, but beyond that, there's still the medical fear that you might have cancer or that you might have some terrible disease, like some autoimmune disease. And I want to help you understand that you can cope with fear in a different way. So rather than avoiding getting tests, so I always tell people, even though I do integrative medicine and I do functional medicine, and I want people to avoid surgery whenever possible or avoid, major invasive procedures. If you have a medical problem, the reason that medicine exists is because it can help. And there are, especially doing tests, there's so many ways that getting the right testing and getting the right answers can help you feel safer and more secure. And so I want to offer that to you as an opportunity. So to some degree, the fear is never going to go away. Like there's going to be scary things that happen or scary imaginations that we have. And so one of the things that you can do to deal with it is to begin to observe. So instead of, letting your fear take over, you can begin to watch yourself having that experience of fear. And so you can kind of separate yourself from it by breathing and looking at the fear as if you were watching a movie. So you just look at it and you go, okay, there it is, and here I am, and I don't have to engage here. So that's first. So, begin to observe it. And the second thing, while you're observing and while you're having that experience of fear, I'm always talking about breathing. And, there's lots of science on the power of breathing to calm you down. But so what you do is you breathe in for a count of 4, hold it for a count of 4, and then let it out for a count of 6. Hold, let it out for a count of 6. Hold, let it out for a count of 6. It's hard for me to talk and breathe at the same time, so it's hard for me to express this to you, but try that and see if it calms you down. And then just while you're doing that breathing, just observe your fear rather than letting it take you down. And keep watching instead of letting it take you into a place where you can't control how your emotions are. Excuse me. And then the other thing that you can do is research. and look at the facts, So there's science and there's information out there, and there are also miracles. And even if you're worried about a terrible diagnosis, you can still have a positive outcome. There are people who have defied the odds and overcome cancer. There are defied the odds and overcome terrible diseases, autoimmune diseases. There's a lot of research and information that can help you overcome it using functional medicine. And there's healing possibilities. There are books written. So research, if you're worried about something, then begin to look into the science. But don't look into the scary science. Look into the science that gives you hope. Look into the science that gives you positive answers. I have a patient right now who has pancreatic cancer, and they were never able to find a tumor. And she is so courageous and so powerfully willing to go through what she's going through. And she comes in to see me every week, and she is positive. And she's like, I'm doing great, and everything's going great. And she's having chemo, and she doesn't need radiation, but she's having chemo, and she's also having acupuncture and taking supplements from a cancer specialist herbalist. And she is doing great. Her numbers are going down, and she's got a lot of support. So even though she has one of the most terrible diagnoses, she's powerfully in tune with herself and able to deal with the fright and the fear of it. Sometimes once you have an answer too. So another thing is that people tend to avoid getting an answer or a diagnosis because they don't want to deal with that answer. But sometimes once you have an answer, you can feel better. So I always encourage, again, taking testing that will help you understand what's going on with you so that you can then deal with it and feel better. And then there's one more thing I want to talk about, and that is not actually the fear, but the avoidance of, because you feel fine. A lot of people talk about they feel fine, so they don't need to do anything. And there's a whole spectrum of what is fine and what is wellness that you can deal with, and to help you be better healthy, or more healthy. And so rather than avoiding getting certain tests or avoiding getting care when you still feel good, might lead to something more difficult for you later, and a lot of times when we feel fine and we don't do anything to continue to feel fine, we think that we're still okay, but then something terrible happens. Like one of my patients was doing fine and actually had a bunch of testing, and then suddenly collapsed one day with a heart attack. And she's a woman, and the science is actually that women have mysterious heart attacks, or have symptoms that aren't traditional symptoms. And so she was sort of brushed off when she first saw a cardiologist, but then she suddenly had a heart attack. And then that, of course, generated a lot of fear because she had already done all the testing and it showed that there was no risk. And then she turned out to have had one. So for her, the fear was to have another one. And again, if that is the case, then you research and you look at, and your doctors are going to give you probably whatever the latest science is, and what they think you should do. And then you gather that information, you get your team together. So another thing that I recommend is getting a team together of people who are experts in their field so that you can get the best of everything put together so that your care is comprehensive. And I always think that comprehensive care includes Western medicine and Chinese medicine and functional medicine all together, because all of those areas have something to offer for your wellness. And that will help you, again, deal with whatever health condition you have in the best possible way. I hope you found this helpful, and please leave your comments. I'm happy to answer any questions. I hope you have a wonderful day. Thank you.